My name is Taylor Levick. I'm a chiropractor in Charlottesville, Virginia. Today we're going to be discussing the McKenzie method, which is something that we employ heavily at our clinic, Jubilee Spine, here in Charlottesville, Virginia. This presentation today is meant to be more patient-facing, so if you're a clinician and watching this is not going to really get in the weeds as you might want, but for patients, this is really going to give you everything that you need to know about this method. So if you've been given a McKenzie-based exercise, then go ahead and follow along, as this will really include a lot of the information that you need to know with these exercises. So first off, what is the McKenzie method? We're going to be talking today about directional preference. I'll define that in a minute. We're going to be talking about centralization of symptoms and peripheralization of symptoms, so we'll define those as well. If you've been prescribed these repeated movements, things such as back bends, extensions, you may have been wondering, why am I doing these? What should I be feeling? How do I know if they're helping? And really, when should I stop doing these? So today we'll discuss the principles behind mechanical diagnosis and therapy, or the McKenzie method, directional preference, centralization, and how to really recognize positive versus negative responses to using this treatment. So what is McKenzie MDT? MDT stands for Mechanical Diagnosis and Therapy. This method was developed by Robin McKenzie, who was a New Zealand-based physiotherapist. There's a cool story that I'm not going to tell today about kind of how he initially started to identify some of these things, but the McKenzie method is a system used really worldwide to assess and to treat musculoskeletal pain, especially spine-related conditions, though it's also heavily used in extremity conditions. And rather than focusing solely on imaging to help formulate a diagnosis, MDT focuses on how your symptoms respond to movement. Your body's response often provides important clues about what's driving your symptoms and what can help reduce them. The great thing about this particular method that I really love is that if we can identify the movements that are consistently improving a patient's symptoms, that's going to empower the patient, because they can now act as active participants in their own recovery, and they've got some tools in their own toolbox now to help manage their symptoms. So your body is going to give us information. One of the key ideas in MDT is that symptoms are really not random. The way that your symptoms respond to movement can help identify what movements your body currently prefers and which movements may be aggravating the problem. So some positive indicators when you're performing these exercises are that your symptoms start to reduce, your mobility improves, and you might start to notice centralization of pain towards the spine. And again, I'll define that here in a minute. Some things that you need to be cautious, though, if you're performing these exercises, if you're starting to notice an increase in symptoms, if you're noticing that your mobility is reducing, and especially if you're noticing a peripheralization of pain away from the spine. Again, a concept that I will define here in just a second. Now, what is a directional preference? I've used that term here a few times, and the definition of it is a direction of movement that consistently improves symptoms. And these could be different directions that we repeatedly put the spine or put a joint through. It could be extension, it could be flexion, side glides, rotation. So if you're a patient of mine and I've given you a repeated exercise, we're trying to assess for a directional preference. MDT is different than a lot of kind of traditional exercise modalities, because we're not simply trying to exercise a body part. This is not something necessarily to build strength or to build endurance. What we're trying to do is identify a specific direction of movement that causes your symptoms to improve. And that preferred direction can become really a powerful treatment tool. So a common example here would be extension. Oftentimes for someone with lower back pain, I might have them laying on their stomach and they are doing a press up type motion, repeated extension. And what we're looking for here is centralization of symptoms. Again, I'm going to really define this here in a second, but their pain initially might be in the lower back, but radiating into the buttocks and even into the leg. And if we have them do a few rounds of these repeated extension movements, then the pain might just be solely in the lower back, which indicates that centralization of symptoms. And this is a very encouraging sign if we can get that type of response. So let me talk a little bit about centralization, because again, this is kind of a key thing that we're searching for with MDT. So centralization occurs when pain that has spread away from the spine begins moving back towards the center. So even if symptoms become temporarily more noticeable in the back, which is not uncommon with this method, this is often considered positive if pain is leaving the leg or if it's becoming more localized near the spine. Many MDT practitioners consider centralization to be one of the strongest indicators that you're moving in a positive direction. So you can see on this slide here an example of centralization. Let's say we have a patient who's got lower back pain and it's radiating all the way down to the calf. If they perform some repeated movements and now the pain is only radiating to the thigh, that would be an indication of centralization. Similarly, if the pain was going from the lower back and into the thigh, but after these repeated movements, the pain is only in the buttocks, again, that's a very positive indication that we are centralizing symptoms. And similarly, buttocks pain that after a few rounds of these exercises is now just solely in the lower back, a good sign of centralization. And we could even say that pain that is just solely in the back, but is maybe widely distributed in the back, that after doing these exercises, if it becomes more and more pinpoint, that could also be a sign of centralization and a good prognosis for that patient. So what centralization might feel like. Patients are often surprised when leg symptoms improve, but the low back pain sometimes can become more noticeable. In many cases, this represents the pain becoming more centralized rather than it actually getting worse. The overall pattern matters much more than a single sensation. So some positive signs here would be that we're having less pain in the legs, certainly less neurological symptoms such as tingling. If the pain is becoming more and more focused and it's not as widespread, and certainly if we retest movements afterwards and movement improves, that's often a very good sign as well that things are centralizing. Again, I want to note here that a very common temporary response is that you may have more local back pain after performing these exercises, but this is not necessarily a bad thing. Now, peripheralization is exactly the opposite. So this is when symptoms move further away from the spine. So pain moving farther down the arm in the case of symptoms related to the neck, or further down the leg in cases of symptoms originating from the lower back, this would be considered a less favorable response. And this may suggest that the movement being performed is not currently the best choice for that individual. And there are certain individuals that just do not respond, and we can't find a specific directional preference. But peripheralization is something that we want to try to stay away from. So an example of peripheralization might be a patient with just lower back pain that performs these exercises and now the pain is radiating more into the buttocks, or the pain was just in the back and the buttocks and now it's starting to radiate into the thigh after performing these exercises. So you can see that the symptoms in this case are getting further and further from the spine, and that is indicative of peripheralization, which would be kind of a negative thing. We do not want to see peripheralization of symptoms. So what peripheralization might feel like? Again, a brief increase in discomfort during these exercises is not always concerning, but what matters is what's really happening afterwards. Are the symptoms settling down? Are they becoming more widespread and lasting longer? So certainly if we're noticing that there's new symptoms below the knee, if there's new numbness or tingling, or a wider distribution of pain, that is not ideal. If symptoms are lasting longer after exercise, that would also be a negative indicator. And certainly if you're noticing a decrease in function after performing these exercises, these are all things that you would want to tell your medical provider, and would be kind of an indicator that we need to change course. Now, one thing I do want to point out is that these exercises can be uncomfortable. So do expect that there might be some soreness during these exercises. Some might even call it pain, but that does not necessarily always indicate that there is harm or that there's more damage that's occurring. So some things that we need to ask while we're doing these exercises, again, is the pain centralizing? Is the painful area shrinking? Is it getting nearer to the spine? Is your movement improving? Do your symptoms seem to settle quickly afterwards? That's also, again, a favorable sign if we see that. So signs of positive progression. Improvement is not always going to be a straight line, but over days and weeks, there are patterns that we do want to see. So sometimes symptom location changes before the symptom intensity changes. So if your symptoms are moving towards the spine, if your leg or your arm pain are decreasing, again, if mobility is improving, if your symptoms recover more quickly, if daily activities are getting easier for you, and if your pain is becoming less frequent, these are all signs that you're moving in the right direction and that you want to continue to kind of keep course. Now, signs of possible regression. If these patterns are consistently occurring, it's worth discussing with either myself or with your medical provider. And these are indications that the exercises need to be modified, or potentially they need to be progressed, but often more so they need to be replaced and discontinued. So these signs would be if symptoms are moving further away from the spine, if numbness or tingling are increasing, if your mobility is worsening, If recovery is taking longer, if your daily activities are becoming more limited, or if your symptoms are getting more and more aggravated after exercise. These would be reasons to discuss with your healthcare provider a potential change of course. So again, as you're probably picking up, there's more that we want to keep track of than just the intensity of the pain. We want to pay attention to things like the location of your symptoms. The symptom intensity is worth paying attention to, but is your mobility improving? How's your walking tolerance? Is that getting better? How's your sitting tolerance? Is your sleep improving? How's your daily function in general? If these things are all moving in the right direction, even if your symptom intensity hasn't really come down quite a bit, again, those are good indicators that you're moving in a positive direction. And last, I'd be remiss to say that these repeated movements are incredibly helpful, but they are only one tool. So long-term resilience comes from helping the body move well, to recover well, and to gradually build capacity again. So your recovery is probably not just going to involve these exercises. While they can be powerful at kind of putting the fire out a little bit, we still need to work on improving your movement quality, on building strength, on improving mobility in certain areas, on getting you more physically active again, improving sleep, improving stress management, improving nutrition. Really this holistic approach is what's going to help continue to keep your symptoms at bay and build more capacity and more ability to do the things that you want to do without a re-exacerbation of your symptoms. So some key takeaways from this little video today: your body is constantly giving us information about how it's responding to movement. And so understanding concepts like directional preference and centralization can help you feel more confident, more informed, and more engaged in your recovery. The goal isn't simply to reduce pain, it's to help you move better, to function better, and to return to the activities that matter most to you. If you have any questions with anything that we've covered today, feel free to drop a question in the comments below.